the main thing is that now people are afraid to speak about tinnitus to their ENT doctor or to their clinician because they don't know what to expect. And the thing is, we know that cochlear implants can be a good treatment, but it's really hard to give some hope or at least to speak about it without knowing what does it entail. So we hope that the further step for us is to know who will benefit from it and so that the patient can feel confident that he can try this option.
Hey, everybody. This is Michael Piscos from MindEar, and you're listening to the Tinnitus Unplugged podcast, the show that answers all your tinnitus questions and helps guide you through your tinnitus journey. Tune in regularly to listen to a variety of world-renowned tinnitus experts share valuable tinnitus management tips and information to help you manage your tinnitus. To learn more, visit us at www.mindear.com. Welcome to another MindEar podcast called Tinnitus Unplugged, where you can learn everything you need to know about tinnitus. And today I'm very happy to share that we have an esteemed guest, Dr. Kelly Assouly, from working in Belgium at the moment, who's going to talk to us a bit today about tinnitus and cochlear implants, which is an interesting topic, not something we've covered on the podcast before. So I'm very excited to introduce Dr. Assouly. Welcome.
Thank you.
So, Dr. Assouly, give us and our listeners a little introduction about yourself and what your experience working with tinnitus patients over the years has been.
Yeah, I'm really glad to just participate in this webinar. Thanks for the invitation. So, as you introduced me, I'm mainly working in Belgium in this big company, which is called Cochlear. That's a company which is creating cochlear implants. But I'm also a researcher in the UMC Utrecht, which is an hospital in the Netherlands. So my work is actually a combination of more from the technological parts, but as well in the research and clinical parts.
Wonderful. So you got your hands in a little bit of both.
Yes.
Yeah, wonderful.
I'm between the two worlds, trying to also make connections between the two. And so I started all this by actually doing a PhD on the topic. So there was a collaboration between this company and the hospital for my PhD, which was aimed to assess the effect of cochlear implants on tinnitus. So that's really the topic of my research, and I'm currently still working on it and trying to improve our understanding about this topic.
Great. So you'll be able to share a lot of great information today with our viewers. So we've used the term cochlear implant a little bit so far. For our viewers who may not be familiar with what a cochlear implant is, can you spend a couple minutes explaining what a cochlear implant is and who might wear a cochlear implant?
Yeah, sure. So a cochlear implant is a medical device which is used for people having severe to profound hearing loss. This is aiming to provide electrical stimulation to the cochlea, which is a small organ which is in your inner ear. And so the cochlear implant has an internal part with an electrode, which is implanted into the cochlea and which provides electrical stimulation, which then turns out for the brain to be a sound. So thanks to that, people who are not able to use their cochlea because it is damaged can then hear again some sounds and also try to listen again, communicate again, thanks to electrical stimulation.
So a cochlear implant is for people with more significant hearing loss.
Indeed.
And how does a cochlear implant and tinnitus come together? Where's the relationship there?
So, as I think you already introduced in your previous podcast, people having hearing loss also have a high prevalence of having tinnitus. So we have seen from different studies that what we call cochlear implant candidates, which are people who have tried a hearing aid, who did not benefit from it and then went to this journey to have a cochlear implant, have around 40 to 60% of also suffering from tinnitus because hearing loss is also a high risk factor of tinnitus. So at the end, the people coming to this cochlear implant journey are also often people who are suffering from tinnitus. And we tend to forget that cochlear implant is mainly for hearing loss, but that's often these people have these two different comorbidities, which is hearing loss plus tinnitus.
And with hearing aids, a lot of research has shown that hearing aids can benefit people who are struggling with tinnitus from a couple of different perspectives. It can
Mhm.
lift some auditory fatigue and stress, but it also can act as sound therapy by amplifying environmental sounds and helping one's brain focus on other things. Is
Indeed.
that similar with cochlear implants as well?
That's a really interesting question. So, at first, as you just said, sounds therapy or sound masking is something which is really beneficial for tinnitus. So, the cochlear implant has already this function, which is that it provides sounds, and so therefore it can mask the tinnitus. But what we have seen is that cochlear implant is also having a different mechanism of action, which is also going directly into providing stimulation to the auditory nerve. So there is also kind of an electrical stimulation effect that we have seen. And there is, on average, I mean, the people having cochlear implants are also getting a positive effect of the electrical stimulation itself for tinnitus, which means that some people say that the tinnitus is even suppressed, or that, for instance, when they have their cochlear implants, after a while, the tinnitus really disappears. So there is also a mechanism which is more electrical, neuronal, based on the fact that you provide an input to the brain, which makes it a bit different from a hearing aid, which is amplifying the sounds. And we still don't really understand what is covered into the difference between just having amplification of the sound or having electrical stimulation, but it seems to be something different.
So is there research being done to examine that and investigate that further?
Yeah, so we have, there is no study trying to compare hearing aid and cochlear implants, mainly because often the people are not the same. I mean, people who benefit from hearing aids have moderate hearing loss, whereas people who have a cochlear implant are having more severe hearing loss and also needs, have different needs because they also need to hear, to communicate with people. But we have seen that the people who do not benefit from hearing aids and then have a cochlear implant gets a lot of benefits from it.
Yeah, very
So,
interesting.
and there is also another study which is really interesting, where we're providing some sound therapy for people having cochlear implants. So, as I say, I mean, around 70% of cochlear implants recipients have a really good outcome of their tinnitus, but there is still 30% who are saying, okay, I still have tinnitus, I suffer from it. So we also provided them some sound therapy, and they showed that there were some benefit for them because then they could first control their tinnitus, so they could decide to have something on the top, which was also maybe relaxing, which could also mask their tinnitus. So we can also think of a combination if this is possible for a specific device.
And how was that sound therapy delivered, through an app or some other
Uh,
type of mechanism?
there is many three main studies working on the topic. Two different studies worked on just an app. So there is different apps who are also providing sound therapy. And what is really nice with a cochlear implant now is that you can just stream it with a Bluetooth connection. So you just can,
Similar to
yeah,
many hearing aids that have
yeah,
that
indeed.
technology
Or
as
just,
well.
yeah, earphone. I mean, that's working the same. You can just stream what you want to your cochlear implants. And in one of the study, the cochlear implant itself has a sound in it. So it was something a bit more complex, where the sound was directly integrated into the technology. So the patient did not have to stream something and it was always there. So he could just turn it on or off. And we have seen the same effect. So I would say that an app can also work really well if people also need to try that.
And I think, to your point about the streaming technology, it really opens up the options people have for
Indeed.
sound
Yeah.
therapy. So it's not a one size fits all. Not everybody likes to listen to the same sounds. People like to listen to sounds for different reasons, and this type of technology gives that flexibility, which I
Yeah,
think is
indeed.
is great. One of the things, you mentioned how there with the CI, the cochlear implant, what makes it a little different than hearing aids is that in addition to sound therapy, there's this electrical stimulation that can be beneficial for some people. Um, I would imagine for cochlear implant patients, just like non-cochlear implant patients who struggle with tinnitus, things like managing stress, relaxation exercises, making sure mitigating hazardous level of noise exposure. I imagine those things still apply to people with cochlear implants as well.
Yes, indeed. So I've done a big survey and a forum discussion to also try to, as you say, understand what are the specific needs of people having a cochlear implant and still having tinnitus. And it's quite similar. I think concentration, being in a group where there is a lot of noise is really hard for them. But we also have seen that it's really differ from people to people. So we cannot say that everyone has the same
Right.
difficulties linked to tinnitus. There is, yeah, I think that's really something individual for just people having tinnitus. So we also ask, how do you manage your tinnitus? And the majority say that just when they feel that they have too much tinnitus, they just put on the very cochlear implants. So a lot of people say that they have struggled to sleep, for instance, and if it's too hard, then they just put their cochlear implants and the tinnitus is reduced. But it's not the case for everyone. So that's why I think the main thing is to really identify the needs and then try to see what are the habits or management strategy you can adopt to really adjust, depending on your needs and your tinnitus.
And I think that really highlights the unique needs from case to case, that each
Indeed.
person, although they may describe their tinnitus similarly to other people, the way they experience it and the way it affects their lives is very unique from person to person.
Mhm.
Yeah. And I think that's a really important point, right? You had mentioned, so you still have one foot in the research arm of things. Can you share a little bit about the research you're doing and what you kind of hope to find out from that research?
So I'm currently working in these two different instances, and one future aim we would like to investigate is to be able to predict the effect of cochlear implants before the implantation. So as I say, I mean, the majority of people will have a positive effect, but there is still a part who might not have, a benefit or even have maybe a negative effect, and that's still something really hard for clinician because they don't know how to speak about tinnitus beforehand. They do not want to put too many expectation to the patient. So we would like in the future to be able to predict in advance if the people will have a benefit or not, and at least that they are aware of it. So that's for people who will benefit from it, we can really say, we also have a tinnitus treatment for you. And that's maybe, the best treatment depending on your needs. And for people who won't benefit from it, that we can at least say that they might try something else before going with this hope that tinnitus will be resolved. So we are now collecting a lot of data to maybe create a predictive model out of it. We are, of course, not the first one doing that. So we actually hope that by collecting data from everyone, so we will contact a lot of different studies collecting data. We have screened a lot of articles, and the idea is that by gathering everything together, having a good statistical methods, then we can also try to go further into predicting the outcome.
Yeah, so what would that mean to a patient in the
Yeah.
real world struggling with tinnitus? How and to a clinician as well?
Mhm. So I think the main thing is that now people are afraid to speak about tinnitus to their ENT doctor or to their clinician because they don't know what to expect. And the thing is, we know that cochlear implants can be a good treatment, but it's really hard to give some hope or at least to speak about it without knowing what does it entail. So we hope that the further step for us is to know who will benefit from it, and so that the patient can feel confidence that he can try this option. That's there is something that could work for them.
More
But
educated decision.
indeed, yeah.
Yeah.
And also to put awareness into this clinical pathway, because we also heard a lot that people having cochlear implants never really discuss tinnitus with their clinician, or even not mention it because they thought, yeah, I don't know if they could help me, or maybe they are not interested by it because I already have hearing loss issues. And that's something really important to also mention, that you are a tinnitus patient and you need to have education, awareness, also maybe adapt, the way you wear your cochlear implant or fits your device depending on your needs. So we hope that by selecting the people, also putting more emphasis on what can be done or not done, we can improve the life of people maybe having some doubts about this
Sure,
option.
sure. And I think you highlight something there that, it's not talked enough about, because I don't think many people, and this probably falls on the industry to a large degree. The average person out there doesn't necessarily understand that tinnitus is part of hearing health, and
Yeah.
thus they may not think of it as something relevant to talk about. And that's unfortunate, because to your point, if they talk about it with the research that you're doing, to be able to identify particular subpopulations makes everybody's job better, and better
Yes.
outcomes for patients. I'm curious, in all your research and your time working with cochlear implants, we find it's very similar with the hearing aid population, that tinnitus is not talked about enough, and there's not enough services out there to help these individuals. And there are some surveys out there, that things like the tinnitus and hearing survey, which can help prioritize what's the primary concern for someone. Is hearing loss, is tinnitus, is sound sensitivity. Unfortunately, these questionnaires aren't used enough in clinical practice. But in my time working with tinnitus patients, I found that a good percentage of people, I wouldn't say the majority, but a good percentage of people, even though they had hearing loss, their primary concern was their
With
tinnitus,
tinnitus,
right?
yes.
I'm curious, because going forward with a cochlear implant is such a life decision for an individual to make. Is there a subset of cochlear implant candidates who make the decision with the primary driver being tinnitus, even though they understand the hearing loss will be a secondary factor?
So I think it's a really good remark. We do not have a lot of data because we never ask the people mainly. What is your primary focus? But for instance, we have done a lot of research on people having single-sided deafness. So
Mm,
that's people who just have hearing loss in one side and the other side is really having a normal hearing. And for these people, we have seen that a lot of people have hearing loss, and that in this specific profile, people are looking for help for tinnitus way more than hearing loss. And they often come waiting to have a solution for their tinnitus, and they forget that, the cochlear implant can actually be something, improving hearing loss. That's the main primary outcome, but they come for making sure that their tinnitus is relieved. So for this population, for instance, we know that they have a really burden which is more associated to tinnitus than hearing loss. But of course, also people having bilateral hearing loss do not hear something, but on the top of that, they also have a sound which is constantly here. So for these people who are at a level where it's really burning and boresome, they are also looking for help for tinnitus. And I'm sure, it's not something which is always identified in the clinic.
Yeah, and for our viewers, a question that often comes up is how long does it take for tinnitus, the perception of tinnitus, to go away, and will it last forever? Those types of questions. For the CI patients that you've seen, the ones that do find some relief, is that long-lasting relief in many cases?
So it's of course depend on the patient, but what we have seen is that once the patient have a reduction of this tinnitus of his or her tinnitus, it's stable. So there is a big study who has investigated the effect of cochlear implant on tinnitus for 10 years, and we really have seen that it's a stable reduction. Of course, if the patient is removing his sound processor, it's possible that the tinnitus is coming back. So it's not something which means the tinnitus will disappear. That's something which exists for a few people, but There is also this thing that the tinnitus might come back when you are going to sleep because you don't have electrical stimulation. But if you wake up the morning and you have your cochlear implant again, you will be able to have some relief, which is stable over time.
So there's a couple of things I hear there. One, good wearing practices, making sure you're wearing the
Yes.
devices and using the devices properly and consistently. And the other part of it being that reaching success or finding tinnitus relief doesn't always mean the tinnitus disappears forever. The tinnitus may reappear from time to time, but having those tools and those mechanisms to now mitigate the tinnitus, you can avoid heightened sort of episodes of the tinnitus. Would that be true?
Yes, and you can also have control on it. And I think that's, a topic which is also really important, which is that you can control your tinnitus in a way that you know that if you do something, the loudness might reduce, or that you can, as this stress management strategy, the cochlear implant is in a way another method to manage your tinnitus and have control out of it.
Yeah. And I think, before we come to the last kind of question here, which is more of a fun, open question, I think it's important to remind our viewers that one thing that we do know is that noise is the enemy. And you want to make sure to protect yourself from any type of disruptive or harmful levels of sound or noise, even if you do have a severe hearing loss. You're right. We do want to make sure that people of even normal hearing people of all ages protect their hearing as we move forward. Because as you mentioned in the beginning, we know that hearing loss and tinnitus are strongly linked together. And the best way to mitigate that is to protect our hearing by reducing or eliminating that damage from the start. So wonderful. So as we wrap up here, the last question I have for you, and I ask all my guests this, there's no right or wrong answer. Let the creative juices flow. You know, in Dr. Assouly's, what does the future of tinnitus management look like? What do you hope to see in the years to come as we progress, both in research, technology, clinical standards, so on and so forth?
Yeah, I really hope that we will be able to create a kind of a tinnitus ecosystem. So that's, we also know that tinnitus is not the same for everyone, and that's in a way someone could go to the shop or to a clinic and be identified so that he can just try their treatment, which is working for him, and other things which are not working or patient. And of course, having a cure is, we'll see if we can reach that. At least if we have different strategy, that might be already really nice.
Yeah, I think a lot of people would love to have the cure. We're probably still some time away from that for a variety of reasons beyond just research,
Mhm.
patents and insurance and all those types of things come into play when you start talking about things like that. But I think the hopeful positive message is, though, although there isn't a cure at the moment, there are lots of things that help both cochlear implant population as well as the non-cochlear implant population. I think you really nicely expressed what's being done from the research side. So I think that provides a lot of hope and optimism for people. I love what you said about the ecosystem, right? To the point where individual needs are so varied from person to person. To be able to offer some type of ecosystem where individuals can select what works for them, and be able to
Mhm.
share that in a community with other people. Because I think one thing I've learned over my years is sometimes the things that the people who have found relief share with other people are the most powerful. In the clinical world, we can talk about everything we learn, but sometimes the people that go through it have the best stories to share with other people. And, so to add to your ecosystem, my hope as we move forward is that we build a greater sense of awareness through a stronger tinnitus community. And more people can speak out and more people can share what works for them. So more people
Yeah.
ultimately can find the relief that they're looking for. So I think that's great. Are there any parting words for our audience that you'd like to share before we wrap up here?
I'm really happy that you listened to the podcast. I'm happy also to reply to questions about going through this cochlear implant journey or being a cochlear implant and living with tinnitus. I mean, we have so many things still to learn, to investigate, and I hope to provide some inputs in the coming years. So thanks for listening.
Wonderful. Yes, it's a pleasure, and I think you've done that today, and we look forward to having you again to explain some of the research a little as it gets done down the road. Before we go, are there any websites you'd like people to visit to learn more about what you're doing?
I think you can just find everything about all my articles if you type my name on PubMed. There is also my PhD thesis, which is quite a big book, but the summary is already really nice if people want to have, I mean, an overview of the research. And there is the TUI Academy, which is also a research association which aims to also bring tinnitus education for patients, but also as well researcher, where there is a lot of video on YouTube about researchers presenting their research. So I also hope that could bring some input for people looking for more information about it.
And the TRI, I believe, is Tinnitus Research Initiative, correct? Right. So
Yes,
for our viewers, if you
indeed.
look up the TRI, you'll be able to find exactly what Dr. Assouly is talking about and learn more and answer some questions you may have. So with that, I want to thank you for participating in Tinnitus Unplugged. We look forward to having you next time to share the findings of the research and to share more about cochlear implants and tinnitus. Thank you again, Dr. Assouly.
Thanks a lot.
Take care.